We're seeing that this wild west, of AI is coming to a point of maturity where institutions are stepping in to create some rules, to create some structure, to make sure that, AI can live up to its promise.
With the European Act on AI, we will have to protect ourselves against biases, black box features, not understanding how the AI is prioritizing or protecting against a bias in the recommendation. Hyper-continuous education is when during the visit you are learning because you're consulting the latest evidence.
The biggest challenge that we're still continuously facing is, for me, is context. If I upload one specific data point about me and you tell me what I have, like I said, it's a very myopic picture.
That means for pharmaceutical companies, for instance, the ability to use AI to generate much more frequently clinical evidence.
The opportunity here needs to be understood. I do think that the pharma industry has a strong will to provide solutions to that ecosystem. I think that these tools, can be augmented for the insurance industry, which is exactly what we're doing. Here's something that is live, that you can see, that has the most complete health app out there, completely free, where you can see the impact. And you're invited to build on top of that.
Welcome to LP Voices, Rethinking Health. I'm Grace McNamara, and alongside Ofir Ejnes and Jean-Francois Legourd, we host conversations and guests connecting the ecosystem of health. We talk business and technologies, we explore opportunities and challenges. Welcome to the conversation. JF, Ofir, welcome back. I know our last conversation, we jumped around a little bit talking about the infrastructure, the platform, the ecosystem, because there's an awful lot happening in the world right now. And it seems like every week there is something like drastically changing in an area of this world of technology and AI and LLMs. And it's super exciting. Let's first of all just kick off. What do we think is the greatest change in the last probably 10 days, knowing that things are changing so much? I've got lots to say and lots has happened in the last 6 months, but the last 10 days alone have been quite significant. So, Ofir, over to you first.
I think that what I found super interesting is this absolute explosion worldwide of scribing solutions, where essentially, where doctors use solutions, AI solutions to basically record, the exchange with the patient and structuring it automatically, into notes that they can share and, make it useful for everyone. Dozens and dozens and dozens, of solutions appearing, across the market. The fascinating thing for me is that I was reading that in the UK right now, you have 28% of the GPs that currently use AI and quite often scribing solutions. The NHS recently published guidelines on scribing for all these doctors. So I think it resonates a little bit with the conversation that we had last time, where we're seeing that this wild west, of AI is coming to a point of maturity where institutions are stepping in to create some rules, to create some structure, to make sure that AI can live up to its promise and actually empower clinicians. I guess that the other thing also that's at a higher level, and we can dive into that later, is that I feel that there's a lot of, for lack of a better word, there's a lot of doomsday porn, where we're thinking that you're going to have complete replacement and there's going to be this apocalypse where, doctors are going to disappear. And that's obviously not what's going to happen. I like to quote Jensen Huang, from NVIDIA, when he says that AI is not going to replace the developers. It's a developer that knows how to use AI is going to replace that developer, right? And I think that doctors are very much in the same space. Is that today, as we're trying to essentially, answer the question of how do we build trust in the system? So today, trust is a very specific point. Today, where we can see trust is at the level of using scribing solutions and providing patients with clarity. Right? This is where we live. And I think that we're not at all at autonomous diagnosis. This is not where we are. This is not what we're currently trying to achieve. We're just trying to empower the system. And we're seeing a lot of companies, worldwide that are stepping in to try to provide different solutions. And that, I think, creates a massive opportunity, including, of course, for us.
Yeah, it's a huge opportunity. And to your point, creating trust. We have so much research, it's just bringing it together and putting it in the hands of the person who needs to access that research at the time when they have a question relating to their care, and more importantly, to the doctor's side. Yeah, thinking about the clinical workflow here and the doctor side, I mean, there's so much happening. The scribes is huge. And we saw the cardiologist from Brussels with a hackathon there during the week as well, with a week of creating code and ultimately winning, I think it was thousands and thousands of coders and professional coders. We ultimately created kind of what Ofir mentioned there, that scribe. It was ultimately post-visit or pre-visit AI. It's amazing. But he did it in a week. And he's a cardiologist by training. He was still working. What's your take, JF, on clinical workflows, doctors trusting LLMs, leveraging LLMs for better and more accurate and better healthcare?
Thanks, Grace. Good question. Let me start with first the opportunity. It has been 30 years, and in the world of technology, probably around 30 to 20 years, where people have been bringing solutions to doctors to get them to adopt. And they have massively failed across the board. We are facing an environment here where the problem we're trying to solve is the tool is getting adopted too fast, potentially in certain cases. This is first a celebration about there is new solutions that are coming, that are being adopted at a pace where the doctors themselves are starting to code. This is amazing. This is not enough. This is something to celebrate. That being said, with every innovation that goes fast, there are going to be certain zone of friction. Fair enough. Hallucination of LLM models. That's one. Being mitigated, we see tools that are putting very strong guardrails, and we'll discuss what we do at Healthy about it, but the strong guardrails to avoid pitfall of hallucination. With the European Act on AI that will be coming to place in the mid of this year, we will have to protect ourselves against biases, black box features, not understanding how the AI is prioritizing and protecting itself against or protecting against a bias in the recommendation. But what I see from a clinician workflow is today from pre-visit to during visit to post-visit to education. And education come into force. There was the notion of continual medical education, but we're going to talk about hyper-continuous medical education. Continuous medical education meant 3, 4, 5 times a year, you put yourself in a room or on a computer and you learn about a topic. Hyper-continuous education is when during the visit, you are learning because you're consulting certain of the latest evidence explaining to you what to do now. This is hyper-continuous education. So from a clinical workflow, what happens before the visit with a patient pre-visit, during the visit with a doctor, hyper-education, and contextualize with the patient data on what is the best recommendation now that he has a holistic view of the patient to post follow-up consultation for the patient. This is amazing. And we have the users at the center of the adoption. It's not a top-down approach, it's a bottom-up. We have all the environment to drive a fundamental change in the healthcare world. It's a question about what does that do for the people who were the legacy players, hospital management, trainers, regulators, medical associations, pharmaceutical company, insurers, technology providers. What is their part? Are they a blocker? Are they an accelerator? Are they a protector? That's what we're going to discuss, I think, today. And for me, I'm excited.
It is exciting. I think the Silicon Valley typical scenario of move fast and break things. And then you've got the healthcare juxtapose of move slowly and protect lives. These worlds coming together. Ofir, we saw during the week, Anthropic and the investment around Heidi AI. What's your take on this? How's it going to change what Anthropic is doing, as well as how Heidi AI is going to be operating in the future?
So look, I think that if you zoom out for a second, I think there's a few things that you need to call out. I think that everybody understands, especially, and you can see that either with the massive investment of ChatGPT Health in the US. You can see the various investments. Heidi is one of them for Anthropic. There's different investments that have recently done. So I think we can all appreciate that what we can definitely take away from that is that they want to get into it without an inch of a doubt. And I think that they have a big role to play. I think also that we've seen that they face some hurdles. Jeff was sharing with us today on Slack, that our friends at Heidi are running into some trouble, right? And I think that that's, again, as Jeff was saying, that's what's going to happen, in this period where you have a lot of innovation, a lot of acceleration, and there are going to be mistakes made along. And I guess that this, in some way, kind of comforts me about the direction that we've taken as a company, in the sense, like I said, I think knowledge is going to become a commodity. I mean, you hear this say this ad nauseum, right? I think that the intelligence layer is just going to be like I said, a commodity that everybody can provide. One week, your LLM of choice will be better than the other, and then it will change again, and that's absolutely fine. However, I do think that as we move towards empowering the patient, the biggest challenge that we're still continuously facing is, for me, is context. And we spoke about this in our previous chat, is that if I upload one specific data point about me and you tell me what I have, like I said, it's a very myopic picture, right? You have no idea what's actually happening. So I think that this holistic view of the user and the patient, where all his health data is stored in the same place, I think that's the real battle. The real battle today is convincing, patients and users to put all their data in the same place so they can get the most value out of all these LLMs, that can all analyze it in wonderful ways. But that's the first fundamental thing. And I think that the second thing is that, back to the conversation that we just had about the relationship with the HCP. Again, sure, everybody, as you just said, everybody can now, with the coding machines in a few weeks, roll out a solution where you can hit record and it will structure your note and give you a great summary. That's very available to anyone, including a doctor that never coded in his life, you know what I mean, out of Brussels, which again, I think is amazing, which is great. But the point here is that the value, again, is created from the moment that there is that connection to the patient, right? So for me, it's great that the doctor can record this, but this starts getting value if there is a connection to a patient platform where me as a patient, I get those notes, I enter my data, and I can improve my relationship to my health and to the HCP. Again, empowering me, empowering the HCP. That connection is fundamental. That tool by itself, I think, is great. But again, I think that the connection is where the power is, right? It's the empowerment that you provide. It's independently, these tools don't work. And again, our vision as a company is that we're fighting the fragmentation, right? That's where we live. So for us, the ability to bring to an open infrastructure, right, that anyone can use for free, as Jeff said, on the hospital front, on the HCP front, on the patient front, but it has a holistic view and where data flows continuously. That is everything. That's what matters. The fact that the LLMs will keep bringing better and better solutions, that's actually great. But again, you need the data structured in the right way, following the regulations. And then I'll close with this. I mean, I think that also a big effort that we're seeing in the big LLM companies is that they're working very hard, to try to connect to the EHRs, right, to be able to provide data. There's a lot of publications about that recently, and I do think that at the end of the day, right, to make a long story short, success and all this stuff literally mean that at some point you were able to integrate it to the workflows. That's what it means, right? That's the only thing it means. There are so many what I consider absolutely tragic stories, where you have amazing companies that had an amazing product, an amazing platform, publication through the yin yang, everything was great. And they say, it works, it's amazing. The doctors won't take a second to use it because at the end of the day, it was added work, right? It was added effort. It was not optimization. It was not integrated into the workflow. They had to click 3 times versus 1, whatever that is. They already have a lot going on. So I think that the trust exercise, today trust, I guess it's a good thing, is becoming a feature. You know what I mean? That you kind of have to show up showing, yes, I do follow GDPR, I do have SOC 2, I do have all the HIPAA certifications that you want, I do have publications, I do have all this data that demonstrate that I did things the right way. So I can motivate you, right, as an HCP, as a hospital, as a clinic, to use this, right, integrate it, and finally unlock the value. Because again, finding very cool, it's like when we used to go, when it still was cool to go to the CES, it's easy to show you a gadget that we're 12 geeks in the world that love and that is never going to get any adoption, right? So right now, we have all these very cool things that are popping up. And I think that there's this really effort now into landing the plane and actually make it something that is used at scale globally, but still leveraging the best of what technology has. So long-winded answer to say what I think about the efforts in health for the LLM.
And 2026 is going to be a critical year for this because JF also mentioned that there, the EU AI Act comes into play as well. So there's an element of leveling going to happen where it's necessary to happen. To your point, is going to be, again, fewer solutions in the market, better quality, more rigorous, more governance. So there's going to be less, I suppose, faff, as I say as well. I'm also very conscious, two or three things to comment on. The doctor in Brussels, to be fair, has 20 years of coding, right? So it's not like every
Good.
cardiologist has got to do figuring out how to do
Wait,
these things.
I stand corrected. 20 years of coding.
He's been doing coding apparently in the background like forever. So he's definitely more advanced than the vast majority
Wow.
of clinicians. And to be fair to your point, exactly, actually, he was thinking about it from the workflow perspective. And because he's a cardiologist in a hospital, he was able to implement it into the workflow, which was critical. Exactly that. I know BF has talked about this a lot as well. It has to solve a pain point. Otherwise, it's just good tech. And good tech doesn't survive in healthcare. It needs to be a good tech that solves a problem and a pain point that's actually a really big problem. So that's important. And to your point as well around there's two other data points I want to add. We talked about EMRs and the data in EMRs, and we know that the vast majority of EMRs is incomplete data, right? So it's at a point in time, typically a single result and so on. So that's an important factor. The EMRs don't have a representation of me. My definitely doesn't, because I don't see my doctor too often, thankfully. I don't need to currently. We also know that in the LLMs in particular, there was a really good analysis of the major LLMs and the accuracy and the bias around them. Just for women's health alone, there was 60% inaccurate results. And I was like, that's phenomenal. So yeah, we've got to we're on the right journey for sure of getting access to more data and research and clinical decisions and support and reducing. We've a long way to go, I think. But a long way to go. That could be next week. The pace of change right now it's going to be weekly. So, okay. JF, what does this mean? Like, why does this matter as Elfie and as the ecosystem of connecting the dots here between LLMs, between clinicians, between pharma, between insurers? Why does this matter? What does it matter to the industry?
Doctors and the healthcare providers. I'm talking about healthcare providers, the one that actually do the job, not the one who pays the bill, not the one who scream like the American Hospital Association that the doctors are doing something that they're not feeling comfortable with, but they can't do anything about. Their job is changing. The way they do their job is changing, and they have decided to do so by themselves. However, the way their job is changing is different from in the US, in Europe, and in developing nations. In the US, AI has been adopted as a tool to increase value of care and mitigate personal legal risk. The documentation was the responsibility of a doctor by law or by regulation and organizational constraint, and the proof of evidence was also their duty. This is largely not the case in most of the countries in the world. AI, it will be adopted there and is currently being adopted, but for a volume of care purpose. So understanding how LLMs, AI in general, is being adopted and for what reason and what incentives. So it's important to anticipate how the job is changing. And then based on how the job is changing, how does that impact pharmaceutical companies who interact with doctors, insurers who interact with doctors, one way directly or indirectly, the healthcare ecosystem. They are the patient who interact with doctors. So it's important. Let's look at it. Let's start with the US because it means hyper continuous education, and therefore the need for the interaction in the world of the pharmaceutical companies is being questioned. Why do you need to meet with a medical representative if you can access in a few seconds every time you type the latest scientific publication, which are the only document anyway pharmaceutical company can base their conversation on? What's your value in your go-to-market, approaching doctors to bring them to symposium or to have roundtables? So that changes for the pharmaceutical companies their go-to-market strategy, and if not the go-to-market strategy process overhaul, the type of content that needs to be generated in order to provide additional value. That means for pharmaceutical companies, for instance, the ability to use AI to generate much more frequently clinical evidence. You cannot afford anymore to have one piece of clinical evidence that is milked for 12 or 18 months until you speak about something else. You're going to need to think about it as how do I produce clinical evidence on a monthly basis? Otherwise, I'm completely obsolete in what I have to talk to a doctor about. That's one example. Think about it now. Another example on the regulatory aspect. If doctors are using, in the US in particular, AI evidence in order to protect themselves from a legal standpoint, that means that now it's going to be about the role of pharmaceutical companies on how to make their evidence surface in LLMs. In the non-scientific world, 20 years ago, when search engine became the only way or the main way to be discovered, all companies have to talk about search engine optimization. Now you're going to be talking about, as a pharmaceutical company, scientific LLM optimization. How do you do that? That's a new capability that does not exist at all in pharmaceutical companies due to the limited marketing capabilities that exist due to regulatory and historical infrastructure of that industry. It's not an individual deficiency, it's a structural consequence. So that's an example. But that problem of documenting your work yourself, saving time, and proving that your work is based on the latest evidence is not a priority, unfortunately, in the developing world that is still optimizing to volume of care. Just to give numbers in ranges of proportion here, we are currently in public hospitals in developing world at 50 visits per day. The question is not how to increase value of care in that environment, is how to move from 50 to 70. Crazy. That's not the priorities that you would find in the US or in London or in Düsseldorf. But that's actually the way it is lived in the vast majority of the human population living on the planet today, the doctors doing the doctor job in the world today. So that's there what we're going to be seeing there. And that's what we look at is pre-visit and post-visit optimization of LLM. What does that mean? That means we're looking at the way you support the patient. And what is the role? We stay for a few minutes more on the role of pharmaceutical company. Suddenly, the way that the industry is changing is the way the patient is being engaged prior to the visit and after the visit in order to be an actor in his own diagnostics and an actor in his own treatment. What are the tools and how indeed LLM and the type of tool provided to the patient become a determinant to the success of treatment initiation, treatment adherence, and treatment continuation. This moment of leakage of the pharmaceutical industry are being helped, but by tools where the pharma is absent. How do they play a role there? And how do they re-engage with the patient? Because considering today, unlike what we hear in terms of speech, less than 1% of all the pharma budget is going towards patient engagement. And 85 goes towards doctor. Pharmaceutical companies are structurally HCP-centric, non-patient centric. The word doesn't matter what they say. What matters is where does the money go. For the money, 85% the doctor, 14, almost 15% the payer, public or private, less than 1% the patient. The patient playing a stronger part. How do you rebalance a go-to-market strategy that is around a bit more balanced towards patient, payers, and doctors? And how do you start having a value to provide to the patient-facing tools? With, of course, the constraint of the legal frameworks that applies there. I'll just pause here because I don't want to speak for too long, but that's what I see as an opportunity. And how do I translate the technology into a mandate to act and for an actor like the pharma companies?
If I may, I'd like to double click because it's super interesting. So I agree, obviously. 2 points though. I think that we have to take into consideration that except for the United States, right, as you said, it's not quite clear when you are a big pharma company, in Europe and elsewhere, how much you can actually do, and when it comes to direct to patient for a lot of legal reasons. So there's a reason why they did that. It's not by design that they chose not to do much. There was clearly some framework that they had to follow. That being said, where I totally agree with you is that today there's an opportunity to change that while staying within the framework. And where I also think that something that maybe we're not expressing clearly enough, where why should an executive care, about all this fun stuff, that these big tech companies are doing? Well, simply because the recipe in big tech is to disintermediate completely the legacy player and then make him pay to enter the system. This is the playbook, right, of big tech. So, of course, when we ask the question, oh, yeah, great. No, well, from their perspective, not that great, because today, I think the opportunity is that you have to look what we would call the minimum common denominator, right? So, yes, there are all these very flashy things, like I said, but let's land the plane. Let's land the plane. Today, how can we help? And I think you started alluding to that, is that before the meeting with your HCP, we can send you automatically using very smart LLMs, little things to answer, so you can feed, to have a better appointment. When you're at the appointment, whether it's your assistant doing it or it's you doing it, there's something that helps you have everything super structured and everybody's happy. And then me as a patient, I don't have to be worried that I'm not going to remember anything, that I didn't understand anything, because I'm going to get it, on my app, and I'm going to be able to click on all the words that I didn't get and see what they mean because the LLM is going to tell me what they mean, right? And I think that in that world, I'd say that there's an urgency that's being created because there was always, I think, this will to empower the system, from the pharma executives. That was always there. But I think that now the few things kind of became true. It was very strange, for the health industry to accept, if you will, branded health, right? It's just conceptually it's hard, to imagine, that a hospital or clinic will start sharing a tool that has a big logo, of whatever a pharma or institution that they're sending to all their patients. That's just not going to happen, right? So I think today the opportunity, as you said, is to how can we help the system, and the pharma can step in by sponsoring, obviously, companies like Elfie, where we say, okay, we're providing an unbranded solution to the markets, to the HCP, to the patient, and where inside that system we can contribute to the education, right, of the HCP, to improving the care for the patient. And this, exactly as you alluded to, is just a transformation into the amount of health that it can bring on the patient front, but it is a transformation to their go-to-market model. Because exactly as you said, the go-to-market model today, I mean, is hitting a wall, whether it's a regulatory wall that's coming towards them or just an efficiency wall, especially in the realms of general medicine, versus specialty care. And so this opportunity to leverage all the technology power that the LLMs bring is an opportunity to actually be contributors to the system, whether it's what they call the beyond the pill, solutions that are sponsored by pharma, and now also like being a contributor to the tools that are going to be used by the HCP. And I think that this is how this all matches together, because the good news is that when anything, that's for once, it's really good news, is that when any kind of tool comes out of the pharma world, it definitely went to compliance,
Yeah.
right? I definitely went to regulatory. I definitely got audited 67,000 times, And so the good news is that you can, for once, use that trust, again, back to the trust notion, and go to the ecosystem and say, guys, we went through all these guys. We got this. You can use it. You can trust it. Here are all the stamps. Here are all the all the publications, and you can start impacting and changing the system.
It is great that pharma has such a good structure around accuracy and compliance and regulation and governance, because it does force, and I think it's actually very important now more than ever, it'll force the system to have governance and to have that security and robust rigor in place, which is, as going back to our point earlier, it will see then those that haven't got research, that aren't evidence-based, haven't got good governance, unfortunately dying away, or unfortunately dying away is probably the right word with it. I want to touch on one thing before we kind of head into what it matters for Elfie, but in the insurance side of the world, and we shared as well that Indigo have raised a Series B 50 million, and they're an AI-driven medical malpractice insurance. So we're definitely going to see medical malpractice being important here, and AI-driven insurance, as well as obviously insurance on AI. Dave, do you want to comment on that quickly in relation to where do we see this? How is insurance going to look at this angle?
Two ways, because here we talk about an insurance product covering medical malpractice. Insurers indeed are worried that basically the practice of medicine will lead to patient being not taken care of properly, and to become, if they are vertically integrated, become liable for the insurance that they have provided to the hospital. So here we're talking about the hospital insurance product that we're sold to cover against malpractice in general, and suddenly the utilization of AI being there. You have, as I mentioned to you a little bit earlier, the American Hospital Association that has asked the HHS to regulate and to provide guidelines on the use of what they call shadow AI, unregulated AIs that are used by doctors in order to perform their job better. Because the US usually is a little bit more permissive when it comes to adoption of new technology compared to other regions. What I see here is it will be just simply providing more incentive to use, as Ofir has mentioned, tools that are trusted. And people will be forgiving. And doctors have a right to do things that many actors don't. In many countries, they can go off-label, but they imply their own legal responsibility. So here we just simply see that the necessity to use trusted platform will no longer become an option or a choice build versus rent. The notion of built internally will just be no-go. not because you don't know how to code, just because you cannot ensure the level of regulatory investment that is required to be trusted. And that's in a way that just means it creates an industry of professionals responsible for playing their part. It's a natural process in every innovation. It starts being the far east or the far west, and eventually the value is being identified, the risk is being identified, and the regulatory framework professionalize it all.
It is a good time, isn't it? When you said that, the guardrails and figuring out innovation, how do you align these business models in order for better healthcare in the future? And we saw, as Ofir mentioned, the UK has implemented guidelines around this to put some level of control and support for the clinician, which also reduces the liability. We saw the American Hospital Association also express concern and looking for confirmation of where are the guidelines and how do they leverage AI for the right purpose, for the right outcome, but at the same time, as you said, protecting against shadow AI and the hallucinations there.
Where I'm more worried there is actually I'm not that much worried for the US or Western Europe, because when they put in place a regulation, they usually also have the infrastructure to monitor it, to implement, to enforce it, to provide regulatory guidance by having a case law being brought to life to reassure what the law means for real. And also they have a type of technological infrastructure to empower these technology provider to perform. Let's just take one example. Most of these platforms rightfully have to verify that the user of this platform is a doctor. You would say, that's great, let's implement that as a normal measure globally. Yeah, you just forgot that actually only a bunch of countries have provided an API to verify that a doctor is a doctor. So if a country in the middle of nowhere decide to implement the same regulatory process as the US or Western Europe, what they're going to do is they're going to basically make all these platforms either banned from the country or more likely operating illegally. So it's important as well to realize that these platforms are providing an accelerating transformation, but the regulatory framework will expose many countries that did not do the job of providing the digital infrastructure required for these technology to be fully protecting and protected. We've seen that a lot with data privacy laws. Many countries are rightfully moving towards sovereign data residency. Little pickle, they actually don't have a framework nor the technology infrastructure to allow it to happen. So what you have in practice is, and I've seen that working and interacting with many players in that ecosystem across the world, many players, and being very big healthcare providers or other type of players operates outside consciously of a regulatory framework. It's not that they don't want to, it's just they cannot do it technically. It does not work in their country. So more regulation needs to be budgeted as well with the technology infrastructure that this country needs to provide, the regulators needs to provide. Otherwise, it's a bit of a wishful thinking where the parliament pass laws that they don't want to pay for. And that's a bit of a pickle, putting the private sector, or worst case scenario, the doctor and the patient, the two most vulnerable and critical stakeholders in this ecosystem, in a position of illegality in order to perform their care and receive it. And that would be dangerous.
If you're anything to add from what you're talking about with all of the insurers and the insurance executives, how are you thinking about it, or what are they asking? Where are their concerns?
The insurance industry, definitely, the poor guys, I mean, they've burnt billions, you know what I mean, in various digital solutions that people never used. And at the end of the day, most of them end up basically being a connection to point of care. It's kind of like traffic control, to connect to that guy, and that guy that we signed a partnership with. And it's kind of like, a very underwhelming, status quo of what can be done. And at the same time, I feel that a lot of insurance executives are like, well, even beyond that, I don't know if it's worth for me spending the money right now because it's going to significantly increase my costs in the short term, and I'm going to have to wait too long to see the returns. So maybe the status quo, is what it is. But the consequence of that is that less people that could be insured are insured, and the consequence of that is also that people basically get into the system and don't necessarily answer super truthfully, to the questions to get coverage. So it's a really inefficient situation, and I think that from the LLM perspective, again, not doing science fiction, just landing the plane. I really believe that, the opportunity here needs to be understood. The opportunity here, because you can fight forever, indeed, for who pays for what, but I do think that the pharma industry has a strong will to provide solutions to that ecosystem. I think that these tools, can be augmented for the insurance industry, which is exactly what we're doing. I think that when we provide these tools, because they're sponsored by Pharma, they can come at a business model and a price point that just makes it viable, right? And that because of that, it creates opportunity. Again, it can be as basic as just the AI can detect certain behaviors and can detect certain data points that connect you to the right point of care at the right time. It can be as simple as that. Just that is a massive win. I mean, ask to any, insurance executive and you just ask them, what would be the impact if people actually got in touch with the HCP at the right time? The amounts are insane, almost as insane as the valuation of some LLMs, right? So here, so here, again, it's about saying there are things that are going to take time for sure, but there is a very real opportunity. And just maybe to piggyback a bit on what Jeff was saying is that I believe that rather this industry that's being born is more of a transformation of the way you see technology and what it means inside the pharma industry and inside the insurance industry. Because I think, look, it's very normal that everybody tried, to build solution A, solution B, solution C, and just dropping them, on the app stores and more websites, adding, like we say, always to this fragmentation. But it makes total sense. But I think that the same way, to take an analogy, I think that the same way that a Microsoft takes shares, in an OpenAI, the same way, that Amazon and inside an Anthropic, I think that what you're going to see is that you're going to have a new kind of relationship, right, that is born between those different health stakeholders inside companies, I believe, like ours, right, where you're going to basically transform the way solutions come to market and how they leverage under a super regulated framework, following the best practices that this industry has been following since forever. And this is why it will land. So we're going to see a lot of exciting little stuff appearing. And I think that, again, the job, land the plane. Where can you use it right now? Have impact right now? Have ROI right now? Don't talk to me about 20 years. What's happening right now? And I think that this is what's very much in the mind of all the executives in general, is that, sure, fireworks everywhere. What can I do right now, right? In a thing that fits my budget and actually has impact.
Yeah, to connect the dots, as you said, you've got the Ofir Care, which is the HCP platform, and leveraging LLMs and AI to support that healthcare professional to do the best work they can do in a trusted way, and create trust, but also create what they're looking for in the future, which is helping the decision-making tools, but without hallucinations. At the same time, you have Ofir Protect, which is for that insurer of how do you bring all of this together for the insurance so they can support hopefully more people to be insured.
Which I just look at the three of us. I mean, the three of us were very fortunate in our lives. We've traveled, we've been a lot of places, and by consequence, we've purchased a lot of very fancy insurance. I have no idea how the app looks like. I mean, I'm sure I find the claims here and there, but you know what I mean? Most of the time, I wasn't even the one doing it. But the truth of the matter is that, and again, and this is where I always say, I don't like to get lost in very complicated statements, because there's a ton of companies out there, that say, oh, use me to build your next amazing, insurance product, blah, blah, blah. But here's the thing. The cardinal sin, number one, right, of all these apps is that nobody goes there. Okay? Let's start with that. And the thing that we did, not an insignificant point, we said, you know what? We're going to put it for free out there. And everybody that talks to us can just go and see the stats that we have. They can see the traffic that we have. They can see the engagement that we have, right? It's simple, because if you don't have usage, that's that's used to be a big thing at Microsoft, right? Use it. That's it. That's the religion, right? Then it means you actually have something. You have data, you can act on it, you can do anything. When you don't have usage, you got absolutely nothing. So I think that the starting point is when you talk to these guys and you say, listen, like I said before, I don't want to know how much you already spent on the different variations that are out there, but here's something that is live that you can see, that has the most complete health app out there, completely free, where you can see the impact. And you're invited to build on top of that, something that people will actually use. I don't think it's not an insignificant point, because again, they all have a lot of really smart people, and they all have like amazing actuarians figuring out all the latest models. That's great. But let's just say that because of the nature of the business, and that's why I really, really don't blame them, we have to remember something. Whether it's the insurance industry or the pharma industry, these are companies that can be very successful without necessarily having the most exciting, you know what I mean, user interactions, right? It's just a reality. And so because of that, you know, now that everything is transforming a little bit fast, I think there's an opportunity to rethink who are the right partners to engage with. And I think you have to ask the right questions. And the right question is not who has the shiniest toy. I think the right question is who has something that's actually working, that people are actually using, and that can have actual impacts that you can prove to me. I think quite, you know, again, back to basics. And I think this is the story of tech, right? It always goes like this, you know, oh, well, crazy. Okay. But does it actually work? Right. And I think that now it's like this, you know, back to reality that we always have. The joke used to be, you know, B2B, B2C, B2R, right? And so now, okay, I think it's one of those phases. And I think it's a transformational project on many levels because it's a different allocation of resources inside those companies. It's a different way of building their products, including insurance products. Now, again, look, we already know, it's not even a question, right? That, like we said last time, it's going to end up as value-based care. We already know that. Why today, when I buy a Tesla in the United States, right, and I drive it, they sell me insurance that changes in real time based on how I drive. That is common knowledge. How come that doesn't apply to my life, you know, in health or in other? It just doesn't make any sense, right? I would argue my health is more important than my car, right? It would be better, you know what I mean, to think about this and build those products, and you need the right platform to build those products, right? And I absolutely believe that, you know, you have to be structured or we're structured to be able to do that. Now, this whole yeah, that's why I think that this is a tremendous opportunity for an upgrade for the industry, and it's actually going to unlock tremendous new margins, you know, for those companies because of this reallocation.
I completely agree. It's an absolute leveling up of using everything that's happened in the past in a much more productive, much more efficient way, as I said, and opening up new commercial models and opening up new margins. Any final thoughts?
Next week, end of next week, I will be traveling to a very exciting location in Europe where we'll be part of a very, very fancy congress. We'll be sharing some of our data. I'll report more about that. But even more fun, just to echo again what Jeff was saying, a few days later, him and I are going to be flying to sub-Saharan Africa. We will be on the ground, you know, talking with different clinics, you know, leading the good fight. And we're going to see how we can support them. And everything that you just said about making it real, making it concrete, I think we'll be able to share some really, really interesting use cases.
It is powerful to bring the reality to the world. And as you've been talking about throughout the conversation, is the differences and the similarities across different markets are crucial importance, that we make sure we have that open global perspective. So safe travels in the meantime.
Thanks. See you next week.
Thank you, guys. Thank you for listening to Elfie Voices Rethinking Health. We invite you to connect, share, and subscribe. Until next week, stay curious, stay Elfie.